This is ABC 7 News at 6.
Sleep specialists estimate more than a third of adults snore, which often results in daytime sleepiness for them and their partners. The solutions have been less than perfect, but now a quick and easy procedure may help treat snoring and sleep apnea that often accompanies it, to allow many to get a better night's sleep.
You know, most girls are not supposed to snore, but I do.
And she's not alone.
It's just that you snore a little.
What? I do not.
Yes, you do.
When you talk about snoring, it's always guys.
But in fact, that's not the case. The National Institutes of Health suggest that 30% of women versus 40% of men snore. So 3 out of 10 women versus 4 out of 10 men.
And sleep apnea often accompanies snoring. That's when a person actually stops breathing for several seconds. And it's linked to a host of health problems, from high blood pressure and heart disease to daytime sleepiness.
It appears I have mild apnea, and I do get tired during the day.
Until now, doctors have treated the problem with surgery to shrink or remove excess tissue in the throat, or more commonly with a non-surgical approach using a CPAP machine, which stands for continuous positive airway pressure. With CPAP, a mask is strapped to the face and a compressor gently forces air through the nose, keeping the airway open during sleep. But it can be ungainly and loud for both the sleeper and bed partner.
This procedure is very quick.
Today, Lily is trying something called the pillar procedure, which consists of 3 applicators, each loaded with a small Dacron pellet about the size of a grain of rice.
They're actually very short, narrow implants that are placed into the muscle of the soft palate to stop it from vibrating.
San Francisco surgeon Michael Macdonald begins with a topical anesthetic.
So if you just open wide.
He numbs the back of Lily's throat with a spray, followed by a quick shot. Then he begins placing the implants into the soft palate using a simple applicator plunger. As this pillar graphic shows, the 3 implants sit side by side to help stiffen the throat tissue and reduce the vibration that causes the snoring. The stiffening effect continues to improve as scar tissue forms. Start to finish, the entire procedure takes less than 10 minutes. It was originally okayed to treat snoring, but most people don't realize the pillar implants have now received FDA approval to treat obstructive sleep apnea as well.
In terms of objective measures, there's an almost 80% success rate in reduction of mild to moderate obstructive sleep apnea.
After the procedure, Lily is pleased.
It was very quick, and it wasn't painful.
And a couple of weeks later, she's already noticed a difference.
I wake up more refreshed, and I find myself not falling asleep at 9 o'clock at night.
As for the snoring,
it has gotten so much better. It's not completely gone, but it's gotten at least 50% better. And from what I understand of the procedure, within a couple of months it's even going to get better.
A 10-minute solution to a better night's sleep.
One survey of sleep partners reported a 90% improvement in snoring. That was 6 months after the procedure, but the experts caution the implants don't work for everyone, so be sure to talk to your doctor. We have more about the FDA approval and doctor contact information for you on our website. Just go to abc7news.com and look under Quick Links for Health.